The state does transportation. This year, I have a personal epiphany about healthcare. Now, I've never spent a lot of time working on healthcare. So those of you who came to me, I was a reasonably good vote on healthcare, but I just wasn't that interested in healthcare policy because I could only think about so many things at one time. And I spent, actually, I didn't spend, you spent for me about $500,000 on my personal health care last year, and it changed the way I think about the world. Turns out that state employees, of which I am one, have a terrific health care plan, and I needed it this year, and I got a chance to spend a lot of time at the Fred Hutch Cancer Center watching people go up to the pharmacy window and have a very painful discussion with people. I have one image of a guy, because you can't really stay far away. You don't want to hear other people's financial issues. But you see people there, and the guy comes up to the window, and the lady says, "Sir, you know this is a $700 prescription." And you can just see all the air go out of this guy. How does he figure out how much does he have to spend down until he's eligible for Medicaid? And will that cover everything that he needs to cover? And I got a chance to see this in person, up close, and I was blessed because I had the state behind me as an employer. The way we do healthcare in this country is absolutely ridiculous. This is something we can do a little bit about at the state level. A little bit. We can make sure that we cover all the children in the state. And we are stepping up between now and 2010. We will have covered all of the children in the state of Washington. We made a commitment for that. We're working our way to doing that. And it is really important to do. Children are cheap to cover. And that's why we can do it in a state that has a significantly below average tax revenue. And I don't get me talking about the tax system because it's also crazy. But we can cover children, but at the state level, it's almost impossible to imagine how we could even do what Massachusetts is trying to do because we don't have the tools to state. This is a national problem, and you have an opportunity in November to make a significant difference on how we get this done. And I read, this week I was on the East Coast actually doing tax policy, so I got to read the New York Times. I can't read it here because I just don't have enough time to read all these newspapers. But Paul Krugman wrote an article in the Times, an op-ed piece in the Times, that I would urge you all to look up. And it's called Voodoo Health Economics. And it walks through what John McCain thinks about how we should do healthcare. And he thinks that if you just allow the insurance companies to compete with each other on how to do healthcare, that everybody is going to get covered. Okay, that's the right reaction. It's just ridiculous to believe that that would actually be true. And now, I'm a relatively business-oriented Democrat. I think you got to have an economy, we got to have jobs. The system actually has to work. But believe me, if you allow the insurance companies to compete, they will compete. They will compete to see who can cover groups that only have people who are age 22 through 28 in them, because those people don't tend to get sick very often. And they will want to have people who are in jobs where they don't actually have any physical risk. Microsoft employees, for example. Okay? I mean, you might get carpal tunnel, but you aren't going to get hit by a crane. And this is not what we want them competing on. We want to have a system where everyone in America has health care coverage, where everyone in America has coverage that is not dependent on them being employed by the state of Washington or Microsoft. As a guy who actually thinks we need to have a business system in this country, I can't have a system where manufacturing companies in this country have an extra $1,500 or $2,000 a month per employee that companies in Europe don't have, because it makes them non-competitive. We have to have a national system, and this is going to take getting a Democrat in the White House and holding on to our congressional majority and actually increasing our majority in the Senate so that we have 60 votes, because you can't get anything done in Washington, D.C. today without 60 votes, because they do not work together. They do not behave like adults back there. That is something that also needs to change. We need to control the House, we need to control the Senate, and we need to control the White House, and we need to do health care this year. And you know, there are differences between how Hillary does this and how Obama does this. I can't figure it out. The differences between how Democrats want to do it and how the Republicans do it, I can figure that out. And what the Republicans want to do is not connected to reality. I need all of your help to get Jay Inslee reelected to Congress this year. Jay's people, it's unlikely that he'll be able to come speak to you today. He has a veterans event that he's doing in Shoreline that makes it very hard to get around all the districts. He expresses regret that he can't come. Jay is a good vote on these issues. We need to hold on to him. We need to elect a Democrat in the White House this year, and we need all your help.